Most of us enter the time honored profession of nursing because of the emotional rewards gained from helping others. As a certified nursing assistant working in long term care for over 5 years, I know what it's like to help others. I also know the feeling of being stretched thin from having way too many patients to care for at one time. This has often led me to think about the ratio laws here in California. And it is no secret that nurses have been fighting to lower these ratios for quite some time. And in 2004, safe staffing laws were implemented in acute care settings. And this looks like one nurse to four patients. And in 2017, Senate Bill number 97 was introduced to increase the time spent assisting patients in long term care. Unfortunately, deciphering the law that oversees nurse to patient ratios in long term care is complicated and not as straightforward as the nurse to patient ratios in acute care settings. Long term care is for patients with needs for health and support services like personal care, transitional care. They may be recovering from a surgery or need some rehabilitation. Long term care is available to us all, and we must keep it that way. We must stop the problem of overworked, overwhelmed staff working in these facilities. This problem has the potential to affect us all at some point in our lives. There are several types of long term care, such as in home health, senior living, assisted living, and skilled nursing. Registered nurses, or RNs, licensed vocational nurses, are most prevalent in skilled nursing facilities. And according to Larkus and Carl, authors of Workforce Issues in Long-Term Care, licensed vocational nurses make up about 15% of the staff employed at nursing facilities, and they average 20 patients per one nurse. That is 5 times the amount of nurse-to-patient ratios than in acute care settings. When it comes to direct care, the same article states that certified nursing assistants, CNAs, make up about 2/3 of the staff in skilled nursing facilities and do most of the direct patient care. Regardless of this extra help, nurses are still feeling overwhelmed while on the job. According to Karen Kibbe's 2015 article in Nursing Economics, a skilled nursing facility in California uses a metric method called HPPD, and this is hours per patient day. For example, if a skilled nursing facility houses 100 residents and 200 nursing hours per patient would be 2.5, so that's 2 hours. So to figure out how many hours of direct care each patient is receiving, divide the number of total nursing hours worked in a 24-hour day with the total number of patients within the facility. So what this all means is that the state of California is telling you 2.5 hours is what you should spend providing personal care to your patient. And many of us know that work in long-term care, that putting a time limit on patient care kind of takes away from the meaning of nursing. 3.2 hours is simply not enough time to safely and adequately care for patients the way that we're supposed to, according to the guidelines set by California. To appease nurses demanding better staffing in long-term care, Senate Bill number 97 was passed to increase the mandated HPPD from 3.2 hours to 3.5 hours. In order to abide by these new laws, this new guideline, it would require 350 nursing staff for every 100 patients. Despite its intention, implementing the new law has done little to nothing to improve what's going on in these facilities. Most of the facilities in California are already failing to meet the previous staffing requirements before the new law even took place. In 2018, a Los Angeles Times article written by Ethan Millen titled New Care Laws, Old Struggles. The author states that during the first 3 months of 2018, only 58% of the skilled nursing facilities in California met the 3.5 per patient care day. As promising as this 2017 bill was, the problem with staffing in these facilities has only intensified. Many owners of these facilities who are already understaffed, and even more so now, are applying for waivers from the law, claiming they should be exempt because of the workforce shortage. Many facilities in the state have tightened their budgets. They aren't providing in-house training as they once did. As Barbara Felder put it in her 2018 article in the Los Angeles Times, the number of nursing homes offering in-house training has plummeted from 300 in 2001 to 48 in 2018. So we had 300 to 48. With the stress of heavy workloads and having the desire to help others, just doesn't seem enough for staff to keep their positions in these nursing facilities. Being that 2/3 of the workforce in skilled nursing facilities are CNAs, we are the first to feel the financial pressure and stress. A lot of us are leaving the profession for other types of work, which create a bigger need to train replacements. History has shown that when nurses make enough noise about the injustices in their workplace, they create the possibility for change. Safe staffing laws are not only needed for those of us who work in the profession of nursing, but also all of us as we age, as our loved ones age. We all deserve better. We need to rally the Senate for change and demand better laws be passed.